Barton clinical chair is available to you in a 400-pound and a 700-pound capacity. It is truly a clinical chair, not to be confused with a recliner, in that it offers an almost infinite amount of adjustment points, from a tilt in space to reclining to Trendelenburg. Let's take a look first at the braking, steering, and neutral functions. On the back of the chair, very simply, step down towards you to initiate the brake. Now the chair is locked in place. If I want to be able to turn that chair in a tight radius, I'm going to actually put it in what we call a neutral position, very similar to if you're operating a stretcher. And now that allows me to basically turn that chair in a very tight radius. If I'm going down the hallway as a transport with you either sitting or recline, I will push forward to engage the steer function, and now that chair will track straight as we get down the hallway. The Barton chair offers what we call a tilt in space feature that helps alter that pressure points on the patient's body. This lever, simply squeezed, will allow us to alter that tilt in space positioning. Once you release, it locks in place. If I want to initiate a recline position, I'm going to use this top lever. Again, engage the lever, slowly recline that patient. You can stop anywhere along the way, lock in place, or continue down to a completely supine position. If I had to put this patient in Trendelenburg, I first need to go to a full back tilt in space position, then go to the recline position, hold, go down, and you'll see that we can achieve a completely Trendelenburg position. Let's look at some of the headrest adjustability. You certainly have different height patients. We're going to go to our action point lever here. Only have to turn these a half a turn to loosen them. This is going to allow me to raise or lower wherever I want. Just remember, lock that in, lefty loosey, righty tight. I can actually change the angle of the headrest. Again, loosen this one a half a turn, and I can go forward, come back, right to lock. Another nice feature for somebody who might have some neck control issues is that with this locked, we can actually push in the two sides as tight or as loose as we want if that patient has some head control issues. The Barton chair also has some armrest height adjustability. Simply pull that spring lever back and I can raise or lower to whatever position I want. Each side has that adjustability, obviously. Now, another time that I might want to have that adjustability is if we are going to use this as a stretcher to transport somebody. So we'll bring it into a supine position, and then you can see with the armrest up, we have some side rail protection for that patient during our transport. The Barton chair also has a large amount of adjustability in the leg portion. Obviously, as someone sitting, we can't have their legs dangling. So this is what that footrest is for. That will be lowered after they're in the chair. This is not made to be a stepping stool into the chair. Patients are taller or shorter than others, so we may have to adjust the length of this. You have a black lever on each side of the chair. There's one on this side, there's one on my side. So what I'm going to do is just press it in, and I can bring this up so I can get access for adjustability. I'll flip that back. I don't know if you can see the black adjustment lever here, but again, I'll use that lefty-loosey, half a turn, and now you'll see that I can adjust this in or out to whatever length I want, depending on the height of my patient. Just always remember, right tight that back into place, and we're good to go. So if I now want to lower this back down, that same lever you see over here, I have one on my side. I can press in, and I can lower that down, and now that patient will have a nice footrest here. The Barton chair has great flexibility for cleaning. You can use any of your hospital-approved disinfectant wipes to clean the chair.